Some of the surgeries that we do here at Plastic Surgery Associates of Valdosta do require the placement of a drain after surgery. So a lot of people, their number one concern during pre-op and post-op is the drains. So I wanted to take a few minutes to explain the drains, how we measure the drains, how we take care of the drains post-operatively to see if we can solve any problems, answer any questions before they're placed. This is what we call a JP drain. We use these after tummy tucks, um, lower body lifts, gynecomastia surgeries, bat wing excisions, facelifts, a complicated implant removal. There could be a few more. Those are our most common. Um, so we will explain today after a tummy tuck just to make it more simple. This part typically is under the tissue and fat layer within the body. This is inserted to help drain excess fluid that accumulates there that could cause post-op complications and swelling. It feeds into this bulb here, and this is our drainage collection system. We have the patient measure this drainage output after surgery for us to determine when it is safe to remove the drains after surgery. If the bulb is open like this, it is not vacuuming. We want to seal it off. So you open this port here. You squeeze the bulb like so. I'm going to have to pinch it off because it's not inside of a body. You place the plug back in, and this is how it looks when we are vacuum sealed and suctioning properly. If it is ever open, it is either not suctioning properly or it is too full. So you would call the office and let us know if you're having any issues. To empty these, to record the drainage after surgery, it's important to remember that after a tummy tuck, the patient will have two drains. A drain on the right side, a drain on the left side. It is important for logging it that you use the patient's left side and the patient's right side for logging it. So you will write the date, the time. You will open up the drain on the left side like so, opening up the port here. You'll pour that drainage into this cup. On the side over here are the larger numbers, are our milliliters. This is the numbers we will use for drainage measurement. To plug it back up, you will squeeze the drain and plug the port back up, and we are suctioning again. And then you will do the same for the right side, and you record it for us at minimum every morning and every night, occasionally in between if necessary. Another thing that we will have you do to make sure these drains do not get clogged and to make sure they're working properly is once a day, you will grab the tubing at the insertion point or near the insertion point of the body, and you will pull on the drains like so to make sure there's nothing clogging these tubes, and it will collect down into the bulb. It's not uncommon for tissue and things like that to collect in these tubes, but we don't ever want them to be clogged off and not working. At the time of discharge from the PACU, we will secure each drain to your garment or your clothes using safety pins, and which you will do at home as well to keep the drain from being pulled, tugged, dropped. Important tips in taking care of these drains. Number one, we want to make sure we always keep the areas clean and dry. We don't want the dressings for these drains getting wet, soiled, dirty for any reason. Also, it's important for the person who may be taking care of these drains, emptying these drains, to wash their hands directly before handling these drains. We don't want any risk of infection with a line directly into the body. It's also very, very important to keep up with all drainage collected on this log that we provide for you here. We will want you to frequently submit these numbers to us in the patient Simplast app. This will help us keep an eye on your drainage output and also know when it is safe for us to bring you into the office to remove these drains. You will be given a post-op appointment for a drain check. The morning of that drain check, you will take a photo of this drain log and you will send it to us in the Simplast app, the clinic group, and we will take a look at it and we will let you know if you need to come into that appointment or if we need to cancel that appointment and you resend the log the next day. I hope this has prepared you a little bit for having drains after surgery. Any questions at all, just reach out to us in your Simplast app.